So you can see that this is likely a central mass, as we have a large airway here with these cartilage here. And you can see at low power, we have this relatively well circumscribed lesion here. And when we move down to a bit higher power, we can see that it has this kind of organoid appearance where we have these nests of cells that are interspersed by this fine, delicate vasculature pattern. And the cells are kind of more epithelioid to a little bit spindled in areas as well. And when we look down at higher power, we see that the nuclei have this characteristic appearance with this really stippled chromatin that really is described as this salt and pepper chromatin. So the salt is the fine specks, and the larger, coarser bits are the pepper. And so that gives you the salt and pepper appearance to it. So this morphology and that chromatin is really consistent with a neuroendocrine tumor. And so in the lung, we classify these as carcinoid tumors. And then we further subclassify them into typical and atypical carcinoid. And the distinguishing feature is the presence of mitoses as well as necrosis. And so you have to go through and count the number of mitotic figures. And so you're counting per 2 millimeters squared. And tumors that have less than 2 mitotic figures per 2 millimeters squared are classified as typical carcinoids. And atypical carcinoids have between 2 and 10 mitotic figures. And in terms of necrosis, typical carcinoids should not have any necrosis, and atypical carcinoids can have focal areas of necrosis. Once you start getting more than 10 mitotic figures per 2 millimeters squared, you should start to think about a higher grade neuroendocrine tumor, such as a small cell carcinoma or a large cell carcinoma. But typically, these have much more than 10 mitotic figures per 2 millimeters squared. Typically, you're on the order of 50 or more. And so in this case, we're really not finding any mitotic activity. And as I'm moving around, you're not really seeing any necrosis either. So this tumor is best characterized as a typical carcinoid. Just as a point, we typically don't make the distinction between a typical and an atypical carcinoid on a small biopsy because these can be heterogeneous. But it is important to point out if you do see lots of mitotic activity or necrosis, as that may signify a higher grade lesion. Some of this does look a little bit more spindled, and that's another important point as carcinoid tumors in the lung can be quite spindled looking, especially in the peripheral lesions. And so if you get a spindled lesion before you jump to some type of sarcoma, you should always consider, could this be a carcinoid tumor with a bit more of a spindle cell morphology? Perfect, so that's great.